Welcome to AI Tools for Nurses, a practical learning course. Over the next 5 hours, you'll learn how to safely and effectively use AI assistants like Claude in your daily nursing work. Module 1: Why and What? An Introduction to AI in Nursing. Duration: 25 minutes. 1.1 Welcome and Purpose. AI assistants like Claude are becoming part of everyday healthcare work. Not to replace clinical judgment, but to save time on documentation, information lookup, and communication. This course will teach you what these tools are, how to use them safely, and how to fit them into a real nursing shift. 1.2 What an AI assistant actually means. AI tools like Claude and ChatGPT generate text, summaries, and drafts based on what you type. They do not access your hospital's patient records unless specifically connected. Most importantly, the AI never makes a clinical decision. The nurse always reviews, verifies, and decides. 1.3 Where AI fits into a nursing shift. 6 Real tasks. Drafting patient education handouts in plain language. Summarizing long clinical guidelines. Structuring SBAR handover notes. Translating patient instructions. Drafting professional emails. And quick drug information lookups. Never a replacement for pharmacy. 1.4 What this course covers. Your roadmap for the next 5 hours. We'll walk through core AI tools. How to prompt effectively. Safety and privacy rules. Common mistakes. And finish with a certification quiz. Module 2. Core AI Tools Overview, Claude and Others for Nurses. Duration: 90 minutes. 2.1 Meet Claude. Claude is an AI assistant built by Anthropic. Accessible through a website, app, or sometimes built into hospital software. You type a question and get a written response. Some hospitals license private secure versions. Always confirm with your IT department before entering any patient identifiable information. 2.2 Getting comfortable with the interface. Type a request. Read the response. Follow-up questions stay in the same conversation because AI remembers context. Start a new chat for unrelated tasks to avoid context confusion. 2.3 Drafting patient education materials. Here we ask AI to explain type 2 diabetes to Ravi, a fictional 62-year-old with no medical background. The AI returns a warm, plain language explanation with 3 lifestyle tips. Remember, the nurse must review for medical accuracy before giving anything to a patient. 2.4 Summarizing guidelines and research. Paste a long hypertension guideline. Ask for 5 key nursing action points. The AI gives you a clean checklist. But always verify against the original source, because AI summaries can miss nuance. 2.5 Structuring SBAR handover notes. You describe Mary, a fictional 78-year-old post-hip replacement patient, in plain language. The AI formats it into a clean SBAR. Situation, background, assessment, recommendation. Never paste real names or MRNs into public AI tools. 2.6 Translation and multilingual communication. Translate a discharge instruction into Arabic for Ahmed. Then ask AI to back translate to English so you can verify accuracy. For critical instructions, always use hospital-approved interpreters as the primary method. 2.7 Drafting professional emails and reports. Ask AI to draft a concise, polite email to a physician requesting review of a patient's pain plan. Adjust the tone, more formal, more concise, until it fits your situation. Module 3, Practical Prompting Skills, Talking to AI Effectively. Duration, 40 minutes. 3.1 What makes a good prompt? Clear in, clear out. Use the formula. Role, Task, audience, format, constraints. For example, write a 3-sentence explanation of hypertension for a patient with no medical background. Treat AI like a conversation, not a one-shot request. 3.2 Step-by-step prompting for complex tasks. For a big task like a full patient education booklet, first ask for an outline. Then expand each section. Ask AI to explain its reasoning, or to double-check itself for accuracy. 3.3 Using examples to guide output. Show, don't just tell. Paste a sample of your hospital's template and say, match this tone and format. This is especially useful for SBAR and discharge summaries. 3.4 Practice exercise. Task 1. Draft a plain language explanation of asthma. Task 2. Shorten it to 3 lines. Task 3. Translate to Hindi. Task 4. Back translate and verify. Pause the course now for hands-on practice. Module 4. Safety, Privacy, and Ethical Use of AI in Healthcare. Duration, 50 minutes. 4.1 Why this module matters. Most AI tools are powerful, but healthcare data is sensitive. This module covers the non-negotiable rules for using AI safely in a clinical setting. 4.2 Patient Privacy and Data Rules. Identifiable information includes name, MRN, date of birth, address, and rare diagnosis combinations, only hospital approved. Secured AI systems may handle real patient data. Public AI tools are further identified or hypothetical info only. Relevant frameworks include HIPAA in the US, India's DPDP Act 2023, and your hospital's IT policy. Here's a safe versus unsafe prompt example. Unsafe. Pasting Ravi Kumar's full name, MRN, and date of birth. Safe. A 62-year-old male, newly diagnosed with T2DM and hypertension. Rule of thumb. If a stranger reading the prompt could identify the patient, rewrite it. 4.3 AI can be wrong. Always verify. AI can generate confident-sounding but incorrect medical information. This is called hallucination. Never use AI clinical content without checking it against verified sources. The formulary, hospital protocol, or a physician order. 4.4 Documentation and accountability. Any AI-assisted note becomes your professional documentation once submitted. The same accountability as if you wrote every word yourself. Best practice. Read every line before saving. 4.5 Ethical use in patient trust. AI should support communication with patients, not replace the nurse's personal explanation and empathy. Being transparent when AI-generated materials are used builds trust. Module 5. Common mistakes and troubleshooting. Duration, 40 minutes. 5.15 Common mistakes nurses make with AI. 1. Pasting real patient identifiers into a public tool. 2. Accepting an AI note without reading it fully. 3. Using AI output as a final clinical decision. 4. Assuming AI remembers patients between separate chats. 5. Not double-checking translated medical instructions. 5.2 What to do when AI gives a wrong or unclear answer. Ask it to clarify or provide sources. Rephrase your prompt. Often that alone fixes the answer. If still wrong, stop and use a verified source. 5.3 When not to use AI at all. Emergencies and time-critical decisions. Always follow protocol and escalate to a physician. Any task requiring real patient data on an unapproved platform. And any situation where hospital policy forbids AI use. 5.4 Practice troubleshooting scenario. The AI tells you a drug combination is safe, but your formulary flags it as a major interaction. What do you do? Trust the formulary. Flag the discrepancy. And do not rely on the AI answer clinically. Module 6, Assessment and Certification. Duration, 30 minutes. 6.1 Course Recap. Module 1. What AI is and isn't. Module 2. Core Tools and 6 Use Cases. Module 3. Prompting like a pro. Module 4. Privacy, Safety, and Ethics. Module 5. Common mistakes and how to fix them. 6.2 Knowledge Check. A 5-question certification quiz. It covers privacy rules, when AI should and shouldn't be used, and prompting basics. Passing marks you as AI trained for your internal training records. 6.3 Sign off and next steps. Congratulations! You've completed the course. Locate your hospital's official AI usage policy on the intranet. Contact your nurse educator or IT compliance officer with any questions. Remember, used well, AI gives you back time for what matters most. Your patients. Thank you for completing AI tools for nurses. You are now certified as AI trained. Use these tools wisely, safely, and always with the patient at the center of your care.